this is our client, when you come and greet them after you exit the room, more often than not, the drapes are not going to be perfect. Okay, get back on.
Es que esto no tiene espacio.
Okay, pagkaan pa lang. We'll figure some out. We'll figure out some way to be able to go. So, again, from the top. One thing that you can realize is when you walk in, the drapes are never going to be perfect. Not even if you have somebody like me who's a massage therapist and I'm getting a massage from somebody, the drapes are never going to be perfect. Never. So two things that you want to always make sure. Number one, not everybody is comfortable like this. Okay, so what are you going to do? You're going to take one of these, a bolster. For the most part, they're going to be inside your massage room somewhere. And tables like these, you will usually find them right here. You see how we have 1, 2, 3, 4, 5 underneath this just one table? We don't usually need that many. Usually need one. All right. So what you're going to do is, I'm going to do this first, like so you can see. You're going to place this underneath her ankle. Okay, so basically you want to place it right here. Now, I'm not going to place it here at the moment, because what you always want to keep in touch is that this is not always going to be the cleanest thing. So what's going to happen is that you're going to do this. You're going to go one underneath where they are, and that's where you place it. And what that does is that it takes some pressure off from the lower back. All right? Now, first things first. The very first step that I have is a step that is designed to basically just start enhancing trust in the communication with the client that you have. So the first thing that we have on the board, I actually do need my glasses. I'm going a little blind. I'm not going to get my glasses. Well, please. Merci beaucoup. Excusez-moi, s'il vous plaît. So the very first step that we have is what we call rocking and rolling the back. Okay. So one thing you're going to notice is that the drapes are on. Okay. I still have the drapes on. Why? It's for a very specific reason. I want to establish trust with my client. And why is trust such a big thing? If the person who is in here does not trust you, feels creeped out by you, it doesn't matter the massage. You can have the best hands in the world. It's going to suck. They're not going to trust you. They're not going to feel good afterwards. So by doing this, it gives them the impression, or basically you provide the impression that you're not trying to rush into keeping them naked, you're not trying to peep or anything. You have patience and time. So what you're going to do is you're going to rock the body back and forth. Now, remember when I told you guys yesterday when Keys was doing this to me, what you want is you want to make sure that you get this entire body rocking and rolling like a cradle, right? And notice that you see that it's not this. You see how this is my arms being static?
Mm-hmm.
No, it's step into it. You step into it, you put your body into it, that's how you make sure that the body mechanics are working for you. Okay, so you do that for a few times. There's also a good assessment tool. It gives you a good idea if your client's back is tense in a particular area. You keep your hand on them, and you do the same thing, both sides. This you can do mainly in horse stance, but you can do it in going out. It's just a little bit more complicated. Now, done with that step, first most important step. If you have a top sheet, not this one, I'm talking a top cover, like this one, you want to overexpose the top cover. So, if this is where you would put the other one, this one has to be overexposed. Why? If you don't overexpose the top cover, let's say that you put it like over here, the moment that you start bringing this down, it might roll up, it might bunch up, and if you're trying to secure the drape, it's going to make it harder. Why? Because now all of a sudden, instead of having a thin piece of linen, you have a thick piece of linen like this, and you won't be able to secure it fast enough. Okay? So always, 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 doesn't matter if it's the back or anything, always overexpose the top sheet. Now, conveniently for this class right now, this particular white color is a little bit see-through. So, you can notice that from this white color, I can see that she has pants on, which in terms of this demonstration is great. You're not always going to get that because you do want to get drapes to protect the client's privacy at all costs. But for the sake of this presentation, what am I going to do? I am going to secure the drape inside over here. Now, how am I going to do that? Am I going to do this like this? No, absolutely not. Why? Look at my hands and look at where I'm. What?
Because you're touching her.
Well, I'm always going to be touching her
I
no
mean,
matter
her
what.
private.
You can still touch this area. The importance is the quality of the touch. What does that mean? If I am inserting my hand like this in here, the only direction that my hand is going to be able to go is is towards the inside. So if she feels this, it's like, oh, this is just some guy that's trying, there's some creeper that's trying to go get a piece of me. So how do you counter that? Instead of going like this, you use fingers first contact. Okay, fingers first. Why? Because the fingers go in, but they lift. Okay, they lift this up, and the only way, if she feels those fingertips, she knows that this is the only way that this can happen. Estoy utilizando los dedos, la uña, un punto de contacto, para que tú sepas que la única dirección que puedo ir es hacia arriba, y que no estoy tratando de agarrar el interior, no. So, fingers in, fingernails making contact, that's how you insert over here. And now, you can bring the drape down. That's how, if you want to fasten it because they're still wearing underwear, that's the best way to go about it. That is the CYA, cover your ass, don't sue me way. Alright? Now, let's say that she doesn't have anything, right? Because, let's face it, a lot of your clients are going to be buck naked. How you would go about it is, you can determine where it is, how much that you want to expose. Usually, I'm a lot more open-minded. I will expose to roughly about here. And what you can do if you want to fasten it is that you bring out their arm and you put it on top. That way, they're in charge of fastening. Okay? Is this good? It's good and bad. Why? Because if they're in charge of fastening it, it means that they're also in charge of what? Loosening it up. So they could do the whole sneaky kind of, like, they could do that if they wanted to. So the other way to do it, if they don't have clothes, is the same principle. You take your fingernails, and in this case, you want to go in this direction. Fingernails are always going to be or make contact with the body. You don't want your fingernails going like this. Here, they're making contact with the body. Here, they're making contact with the body. It means that the hand can only move away from the body. So that's how you can do that. Okay? Everybody is clear on why the fingernails are always where we're supposed to be making contact when you're doing drapes. Exactly. Over here, they help you lift up and they can't push towards the body. Over here, they help you secure and they can't push towards the body. So we're clear on that. Okay. So, first step is done. Second step is done. Now, third step is what I like to call the tree stroke. Your ladies' book might refer to it as the caring stroke as well. There's many ways because this is a fairly common stroke with massage therapy due to the fact that effleurage is the stroke that is used to spread oil throughout the body. So I'm doing this in slow motion right now so you guys can see it. So we call this the tree stroke. Number one, you're going to basically start over here at the base of the neck. You're going to go forward, like so. You're going to reach towards the lower back. Step number two is you're going to spread outside and reconnect over here somewhere towards the center. And the third step is that you go towards the shoulders and meet up towards, again, in the neck. The idea with this stroke is specifically that you are going to spread oil throughout the entire back with just a very few strokes. Now you're going to notice that in the board, I wrote that you can do this from either horse stance or bow and arrow, archer. So the good thing about horse stance from this position is that you can keep your weight centered. However, it becomes a problem when you're trying to do this backwards motion. because you have to compromise your back a little bit. So the more technically correct way to do this would be from bow and arrow, which is essentially kind of like this. As you notice, my back is a lot more straight from this position, and I still have leverage, even though I basically have to move towards the side a little. I'm going to do it with this leg so you can see it as well. Go front. Remember, as I go towards the front leg bends, the back leg extends. As I move backward, it is the opposite. And that keeps my back remotely straight. Okay? You can do this with more pressure just by what? Putting more weight into it. And that takes care of step number 3. Now, step number 4 is what I call the knuckle down, which is essentially doing an effleurage with your fists. So what are you going to do? You're going to start over here, pretty much at the base of the shoulders and the upper back. And from here, you're going to slowly just walk backwards. I'm doing this without pressure right now, just so you can see exactly what I'm going to do. And when I get to about over here, I'm going to hold it for about 3 to 5 seconds.
At the sacrum?
Pretty much, yes. I'm doing it again with no pressure. Now, this is how it's going to look like with pressure. So when you add pressure, when you add body weight, you can zoom in for this one if you want. You want to make sure that you see this. See how the skin is folding around the area?
Mm-hmm.
When you do this lightly, you don't really see it. Even if you're kind of just... See how I'm still leaning forward, but you don't see it?
Yeah.
Now watch. Now you see it. ¿Cómo está la presión de nuevo?
Bueno.
¿Qué?
Buena porque me gusta.
Ah, ¿te gusta? Oh.
Sí, estaba bastante tensa.
Ah, ok. O sea, la presión aquí adentro está bien.
Sí.
Okay, see, good. So, this is a good moment to test with your client if they are enjoying pressure. Why? Because you are giving yourself the opportunity to put your entire body weight on the fist. Why? Because the fist is a very stable surface. It's hard. It's got spread. And you can essentially just do like this. Now again, you can do this from horse, but you kind of have to
Be careful.
finagle a little bit. You might have to go on stilts. And
If
you
you're not
run the
that-
risk that you might be stepping on the client with your body, which is what you want to avoid. So, again, if you can't do it from horse stance,
Mm-hmm.
archer stance works just as well. The only difference is that you might feel like one hand has just a little bit more pressure.
Yeah.
Okay? Now, step number 5 essentially is going to be pick a side. For the obvious choice of demonstration, I'm going to be working on the left so you guys can appreciate what it is that we're doing. So, the very first step that we're going to see here is called two-handed effleurage. Now you're going to notice that even though I've been moving around, I've been picking up oil, I've been rearranging my clothes, there has always been
Contact.
one hand maintaining contact. Regardless of what it is that you feel you need to do, always keep a hand in contact. Same thing when you're getting oil. Never let go of contact. So what is two-handed effleurage? Very simple. It's effleurage with two hands. but it's two hands at the same time. So what you're doing is like this. You're going to notice that I am leading right now in bow and arrow stance because it is a lengthwise movement. So one thing that you always need to be clear, it's not like this. If my left foot is facing forward, it means my left hand is leading. So my left hand should be the one that faces forward because that's how you keep what? Your body in neutral. Boom. Boom. 3, 4. Next up, this one can look a little bit more complicated. We just have what we call hand over hand effleurage. So, hand over hand is still a two-handed effleurage, correct? But it is not two hands grazing on top at the same time. So what do? One hand goes first, the other one chases, and as soon as this is about to happen, you just kind of let it go right on top. So it's basically going in circles. Whichever one hand is on top is going to do this. Okay, but if you do it soft enough, it's barely noticeable. It's not like boom, boom. That's what happens if you pause. So you just kind of go like 1, 2, 3, 4, 5, 6. So what else can you do from this position? You can do what I like to call a forearm glide, which is essentially you can do it either like this. That is 100% forearm glide because I am eliminating the possibility of using my elbow tip. And this is still within good body mechanics. This is still bow and arrow stance, but it's a combination because I am bending, like if I was doing what? Horse stance.
Mm-hmm.
Instead of doing it all the way out here, I am putting my body weight on top. See, my body weight, even if my hand is not here, my body weight is focused right there.
Mm-hmm.
1, 2, 3. It doesn't have to be. Does it have to be this forearm? It does not. That also works, but you have to make sure that you do what? That this elbow tip does not go over the
Spine.
2, 3, 4.
And
Yes?
when you were doing the effleurage with the knuckles, you were going on the sides of the spine.
Yes, I'm always working, whenever I'm going up and down, I'm working on these erector muscles.
Got it. Got it.
Okay, some people call it like the back fat pack. It is what it is. It's a set of muscles that protrude.
There you go.
It's not necessarily going to be fat, okay? Now, you can do the forearm like that. Either way is fine. One is maybe probably more correct in terms of body mechanics, which I feel is this one,
Mm-hmm.
because I am working with the leading hand,
Mm-hmm.
okay? But does it have to be the forearm? It doesn't have to be the forearm. You can do knuckle down on one side with both hands. You can do palms. You're going to notice now that when I do the palm, I don't do this. Even though this might feel better for her,
Mm-hmm.
why is this bad?
Because for you,
Yes. Because this is putting what? Strain
on
on
your
intention on this joint right here. So you want to do what? You want to make sure that it's always kind of facing this way.
mm-hmm.
So, palm, palm. Now, here next we have what we call thumb rolling effleurage, or thumb over thumb. And for the most part, I do that over on the lower back. Okay? Does it mean that it's only restricted to the lower back? Absolutely not. The idea of a routine is it has two purposes. Number one, on the days that you feel like absolute crap, you can still do a massage because you can go on autopilot. But number two, it is a reference for different strokes. Just because you're doing this here does not mean that you can't do it here, or here, or here. Just because I tell you do it better here, it's because I feel it feels better like that. Okay? So for thumb over thumb, we are not doing this. This isn't it. Okay? This is how it would look like if that's what I was doing. You see how only this is moving?
Mm-hmm.
Now what I am doing is I am pushing with my entire arm, my
Mhm.
entire body, like so. And then I'm bringing it back. I push with this one. So it's push, pull, push, pull, push, push, push. Am I actually doing this scooping motion at all? No. What it looks like, that's happening because there's obviously some drag pulling back.
Right.
So, boom, 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 boom.
Almost looks like a rocking motion.
Because what you're doing is essentially rock here forward,
Mm-hmm.
or forward. You could technically probably even classify this more like a friction because it's not as continuous.
Yeah.
If you want to be more, more precise. So after that, we have petrissage. So you're like petrissage, but isn't petrissage supposed to be like a lift and everything? Yeah, absolutely. So you have a few ways of going about it. So what you want to do is you want to put yourself in horse stance because when you're doing petrissage, you want to kind of be really in front of whatever it is that you're doing. So what you're going to do is push, lift, push, lift. So you're going to do this back and forth, back and forth, back and forth. Sometimes with certain clients, you'll be able to actually get a little bit of lift like this, and you'll be able to get that throughout the entire back. With her, it's not really that much the case. Okay? But you're still trying to push, and you're feeding this hand, which you in turn then use to lift. Okay?
So it's like an inverse.
Mm-hmm. Okay. So after that, I have, if I'm not mistaken, I have circular friction going upwards. So you can do it either with fingertips, like this, or you can do it more accurately with a palm. Notice that the area where she has been getting worked on is considerably more red than on the opposite side. Okay, so we do our circular friction, which leaves us what? It leaves us up here. So right here, we can just kind of gently start working on the shoulder a little bit. Just give it a little bit of palm compressions, which is part of petrissage. You can do this. You can do a compression that starts off with the thumbs and then into a little bit of petrissage. You can do compressions with your palm just like this, like so, like so. There is no one particular way to do one movement. Alright? Now, why did I go down and then up? Because this next movement requires me to cross to the other side.
Mm.
So it's better if I'm already over here,
Mm-hmm.
making it ready for myself to be able
Mhm.
to cross. Now, you guys can stay over there. Imagine that I am doing this on the, I'm going to do this movement on her left side, but just imagine that I'm doing it over here, okay? So why am I going to cross over? Because what I'm going to do is I am going to pull this part of her body
See.
towards me. And obviously, doing like this kind of doesn't work. So what you want to do is you want to get a little bit of oil while you have it. You want to flatten yourself on horse stance. And what you're going to do is you're literally going to dig in like this. Not all the way in, just
Cool.
on the outside. You're not going to pull like this. All you're going to do, lean back.
Use your body weight.
Exactly. Massage is always based on our body weight. And you can do this either simultaneously.
So your base must be really wide.
Hmm?
Your base
Yes.
must be pretty
right now,
wide.
Yes, my base is actually pretty wide. It's kind of like this right now, because I want to make sure that my back is straight.
Yeah.
For the most part. Okay. Now, can I do this a little higher? Absolutely. But it's going to make sure that if I have to do this higher, it means that I have to make my squat deeper.
Yes.
Whereas if I open my legs, my stance is a little bit wider, but the actual squatting action is less intense.
Mhm.
Okay, so you go like this, you can do back and forth, simultaneous, boom, boom. And then what you want to do at the end is you want to kind of walk it up towards the next shoulder area and bring it down. Boom. Walk it up, bring it down, walk it up, and bring it down. So I'm going to show you how that looks from the actual side of what we're supposed to do. Now next up I have is petrissage in the shoulder. So petrissage in the shoulder you can do from either horse stance like this, or you can do a narrow stance. It doesn't matter. Remember, they're both petrissage methods. It's just a matter of what you feel more comfortable with as a therapist. Alright? Now after I'm done with this, I'm going to go back into two-handed effleurage to get her what? To get her ready for me to go back towards
The other side.
the other side. So how do we do that? By working both sides again simultaneously for a small second.
Mhm.
then from here I would do the exact same routine over here on the other side. I'm gonna skip this for now, just so we can get the video rolling. Now, after you do the shoulder effleurage on this side, it says over here that I want you guys to basically patrissage and
Work the
quote
neck.
unquote work the neck. Now, by working the neck, there's a bunch of things that could actually imply. Essentially what we're doing is, check out the neck. So from working the neck, what it actually implies is just trying to do as many massage strokes as you can. I
Okay.
enjoy at least doing them for about 5 minutes on the neck, regardless of the position I'm at.
Okay.
So how do you work your neck? You can do your basic patrissage.
Mhm.
So basic patrissage of the neck over here.
Mhm.
One goes in, one goes out. While one is going down, the other one's going up. Boom, boom. Notice the body movements. It's not this. It's sink, 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 sink. Move around, move.
So dance steps.
Essentially, I dance a lot when I do chair massage runs. Okay, so that is your very basic patrissage over here. Then you can do hand, you can do thumb over thumb stuff, kind of like this, or you can do thumb effleurage in that entire area. So brace your thumbs, one thumb over the other, move it. Brace your thumb, move it. Brace your thumb, move it. What else you can do to work that neck shoulder area? Simple. More shoulder compressions. You can do them at the same side, at the same time, bilaterally, or you can do one and one. Notice that for the most part I am doing this in horse stance because I am working on a small area in front of me that does not have different dips of elevation.
Mhm.
Okay? Now the neck, even though I do patrissage and it grabs on both sides, the quality of touch that you have on your finger pads,
Mhm.
the one that you have on your thumb,
Mhm.
are different. So you do want to do that on both sides.
Okay.
Okay. So what else can we do here? We
You
already
can do the
did-
fist.
Hmm?
You can do the fist.
Yes, we can definitely do the fist. We can do it like this. We can do it with the ulnar border of our hand like this as well. You can do patrissage on both sides.
Mhm.
But that's mainly neck and shoulder. Where are we missing here? This area. What can we do? Take your neck pad, take your finger pads,
Mhm.
make a little paddle like a flipper.
Mhm.
Just take them in, lean back.
Cool.
Take them in, lean back. Lean back. Lean back. Lean back, lean back, lean back, essentially. So you are always trying to make sure that you are not doing this. If I did this for 3 minutes, I would be tired. It's a matter of going with your body weight. Your body is used to moving you all day. Okay? So after you do all of those things pertaining to the neck, you're not going to just like, no. So you're going to do a tree stroke a few more times to get back, to tell them essentially we're kind of done with this area. And then the very last one, this is the way I do it. And bring them back. Give them a little pat. Get rid of some of the oil. And that is the white belt back routine. Kill it.